I think, healthcare professionals had to make huge changes to how they deliver care in relation to both COVID-19 and non-COVID-19 patients. So I think when it comes to kind of respiratory symptoms, healthcare professionals were managing them by history taking, by doing extensive follow-up and safety netting. But of course, some of these patients had to be seen face to face, and how that was arranged in different practices in different countries differed, across the board as well. Our final selection included England, Belgium, the Netherlands, Ireland, Germany, Greece, Poland, and Sweden. So quite a nice selection in that respect. Say that, of course, doing remote consultations was completely new for most of the healthcare professionals, and they had to deal with lots of uncertainty related to that. They very quickly turned to their colleagues for, kind of both moral support, but also actually information about how do I go about, these kind of patients, and would you have an advice? I think that even the kind of setup of COVID hubs, some of them were, they were set up by different even CCGs and of course primary care networks, which means that, what resources were put into them very much differed across the board. So I think that in turn kind of influenced even, whether GPs had computers provided or not. So I think there was a huge variation, I think, in how much individual practices have been supported throughout the pandemic as well.